Okay, good afternoon, everybody. I'm Jo Bradley, the Children and People Service Lead for Public Health here at Birmingham City Council. Thank you for coming today. We really appreciate your time in helping us consider how we make Birmingham a breastfeeding friendly place to live and work. Just a reminder, if everybody can ensure that they've got their mic on mute during the session, that would be really helpful, please. This session was specifically set up to be aimed at Birmingham City Council and Birmingham Children's Trust employees, but I know a number of you have booked on from different organisations and different areas, so you're welcome to stay, and we'd love to capture your views in the questions we have for you at the end or towards the end of the presentation. So first thing I'm going to do is ask if people can introduce themselves in the chat. That'd be really helpful to see where who people are, what organisations they're from. That'll give us a good idea of who's been involved in this. We're going to be using Mentimeter during the session. So my colleague Lewis will put the link and the code into the chat as well for the appropriate moment. And whilst you're introducing yourselves now, I'll kick things off with a bit of scene setting, and I'll leave a space to look at the chat and any simple questions at the end, if that's okay. And I say simple because that's my level of knowledge, really. So Lottie, can you just keep an eye on the chat for me, please, in case there's anything? And I'm looking at my notes, so I can't really see anything that's going on, so please bear with. Lewis, can you change the slide for me, please? Thank you. So those of you here, you may well be aware that breastfeeding is one of the most effective ways to ensure child health and survival, and breast milk is the ideal food for infants. It is clean, safe, and contains antibodies which help protect against many common childhood illnesses. Sorry? Is there somebody? Sorry, is there? Just mute yourself. That'd be really helpful. Thank you. So yeah, it's clean, safe, contains antibodies which help protect against many common childhood illnesses. However, contrary to the World Health Organization recommendations, fewer than half of infants under 6 months old are exclusively breastfed. And the UK has some of the lowest breastfeeding rates in the world, with 8 out of 10 women stopping breastfeeding before they want to. The benefits of breastfeeding include the positive impacts on infant health. So those things like breastfeeding has been linked to helping to protect children throughout their lives against life-threatening illnesses and chronic, including infection, diabetes, asthma, heart disease, obesity, childhood mortality, all of that in addition to promoting healthy growth and boosting early childhood development, including brain development. Breastfeeding has positive impacts on maternal health as well, so it can help protect parents from breast and ovarian cancer, diabetes and heart disease. Breastfeeding is also known to help reduce the chance of postpartum depression and hemorrhage, and has positive impacts on relationship building, supporting parent and baby relationship building and their mental health. Next slide, please, Lewis. Okay, so you're going to have to bear with me with regards to the data. Both the England and the West Midlands rates for first feed breast milk are from 2021, but I have it on good authority that the data will finally be updated on the 3rd of December. So it's taken a little while for them to get round to that, but 3rd of December is the date that will be happening. So Lottie, can you pop the link to fingertips into the chat for me, please? So people can check at their leisure after the 3rd of December what the latest data is for their area or for ours. So we've got breastfeeding data for Birmingham. We can see the proportion of babies receiving breast milk at first feed was 66% in Birmingham in 23-24. So that's for last year. And that's compared with an England average of 72%. But as I mentioned, obviously that was last updated in 2021, so that might be different now. There's a 70% target set for us across the local maternity and neonatal systems. That's across Birmingham and Solihull. But according to this data, Birmingham not quite reaching that. We do know that we have some data quality issues that are being worked on in the background. So the real picture might be different, and we hope and anticipate that to be in a positive way. Data in Birmingham is also recorded when babies transferred to the community midwifery team, and then again when transferred to the health visiting team. So, and the next touch points following those two transfer points is when the health visitor makes their new birth visit, and that's around 10 to 14 days. And then again, when baby's 6 to 8 weeks old. So you can see the proportion of babies being fully or partially breastfed at 6 to 8 weeks was 60% in Birmingham last year. And that's compared with an England average of around 53%. So we're above that. So whilst our rate looks better than the England rate, in general, it masks stark variations in rates in different areas across the city. And we know that breastfeeding initiation can vary between different ethnicities as well, with the white British population often having the lowest breastfeeding rates. I also know that for the first 2 quarters of this year, the 6 to 8 week rate is currently 53%. So we've seen a bit of a drop as well. That may change in the next 2 quarters. We have to wait and see what happens there. But generally, there's a tail off between usually first feed and then down to 6 to 8 weeks. We see a general tail off of women and parents who are breastfeeding. So why are the rates not as good as we would like? And that's not just in Birmingham, but generally across the UK. Rates aren't as brilliant as we'd like. So studies show that there are several barriers to breastfeeding. And some of these include, Lewis, can you change the slide for me? Thank you. Some of these include a lack of support and understanding for parents who felt that they didn't receive enough of a clear explanation around the physiology and the process of breastfeeding through the key stages of their pregnancy and then following their pregnancy. We think that there's barriers include a conflicting information being given to parents about breastfeeding. There's a lack of community support once parents leave hospital or their home. There's the marketing of breast milk substitutes that have an impact, intergenerational cultural beliefs. There's medical history, deprivation, and there's a wider cultural issue regarding the public's understanding and acceptance of breastfeeding and parents' sense of safety and availability of places to breastfeed outside a clinical or a home setting. However, these barriers are often context specific and they'll vary from place to place. So understanding and overcoming the barriers is essential to improving breastfeeding prevalence in Birmingham and I'm sure in other areas as well. So what can we do or what should we be doing? So next slide, please, Lewis. UNICEF evidence tells us the strategies for increasing breastfeeding should focus on 3 stages of action. First is build a firm foundation by promoting the physiological and cultural value of breastfeeding. Second is to educate and empower the workforce with the skills to construct a welcoming and trustworthy environment, and we'll be picking that up today later on. Third is create a wider integrated community of support aimed at those who are breastfeeding and their families, ensuring a welcoming and supportive environment within maternity, health visiting services, children's centres, family hubs, community venues, essentially. Let's look at these in a little bit more detail. So what does promoting the physiological and cultural value of breastfeeding look like? Well, it seeks to create behaviour change at its core. And that might be in the form of promoting breastfeeding, positive breastfeeding messages, community awareness raising and events for the supporting role of the community. using social media to raise awareness of breastfeeding, the benefits and the support that's available, creating a supportive environment which enables parents to breastfeed, and that might be through policy and guidance in the workplace, so supporting employees to sustain breastfeeding when returning to work, and it might be through increasing the number of breastfeeding friendly locations and ensuring the wide availability of useful information. And again, we'll pick up on these shortly. So when we look at educate and empower the workforce with the skills to construct a welcoming and trustworthy environment, that might include things like following the UNICEF Baby Friendly Initiative, training staff across businesses to help improve their knowledge, skills and attitudes, enabling them to support parents by creating the right environments to breastfeed, and then ensuring that those new skills are maintained at a high level. It could include following the International Code of Marketing of Breast Milk Substitutes, which is ensuring parents receive clear and accurate information about these products. And then staged accredited programme standards for maternity, health visiting, neonatal and children's services also help it as well. And then we have creating wider integrated community support. And that includes things like baby-friendly initiatives, accredited again, but in a community setting, such as children's centres and family hubs. It might be maintaining access to peer support and breastfeeding encouragement groups. It might be making the workplace a breastfeeding friendly environment, kind of what we're talking about today, providing services that encourage and facilitate breastfeeding. It would be addressing myths around breastfeeding, and then developing community breastfeeding programs. There's one main consideration we need to hold at the forefront of our minds during this work, because we talk a lot about breastfeeding, but we need to be considering how we do all of these things or any of these things without making those people who cannot or choose not to breastfeed feel guilty. So it's an important point to retain when we're doing our work, is ensuring we're not making people feel bad about not being able to or not choosing to breastfeed, and not making them feel guilty about it. So I just wanted to have a brief look at what's happening elsewhere across the UK and what I'm aware of what's happening elsewhere. So if you could change the slide for me, please, Lewis. Thank you. So in West Sussex, Manchester, Bradford, there's a breastfeeding peer support at home and virtually, including with parents who have more complex needs. They're in Bristol, they have loaning breast pumps, enabling lactation management, developing baby hubs, online support groups, helplines, online guides on how to accommodate breastfeeding employees in the workplace. In Cornwall, they have community-based drop-in groups. There are breastfeeding friendly venues or welcome scenes with stickers where hundreds of local venues and services, including cafes, restaurants, buses, visitor attractions and community settings, have signed up, and there's in places like Sheffield, Chichester, Portsmouth, Bristol, Derbyshire. In Northern Ireland, they have #NotSorryMums, which is a campaign aimed at promoting mothers to be proud of breastfeeding. And they do that by sharing their experiences on social media. And in Nottingham, they have a campaign called Feed Your Way, which was recently developed and I believe has had some positive results and outcomes. And it has a whole host of accessible resources that businesses and other people can access and utilise, and they're all free. So when I've been going through those things, I'm sure that you've been reflecting on what you know is happening locally or in your local area. And if you want to add anything that you or your area is doing to improve breastfeeding rates, then please feel free to share that in the chat as well. We're always happy to hear what good practice is taking place and to learn from that as well. If we look to ourselves here in Birmingham, if you could change the slide for me, Liz, thank you. Birmingham was lucky to be one of the 75 local authorities to receive Family Hub Start for Life funding. The funding is helping us to contribute to making Birmingham a breastfeeding friendly city. just from an infant feeding perspective, these are some of the things that we've been able to do and are in the process of doing. So we've been able to fund some additional infant feeding support posts across our local maternity and neonatal system. So they sit within the infant feeding teams in maternity. We've commissioned a co-produced infant feeding strategy. We're just reaching towards the final stages of that at the moment, and that's just been all tidied up. We have funded breast pumps that are available within our local maternity units, and we are currently looking at developing a community loan scheme as well. So we're just working all of that through. We've commissioned a new community peer support offer across the city, and that's been up and running for about 3 months now, 2 or 3 months. So that's just at the start of its journey. We've been working with an organisation called Hitch Marketing who are working with us to develop creative initiatives to promote a breastfeeding friendly city and environment across Birmingham. And the questions and the answers that you give today will help with this work, which is brilliant. And we're also looking at how we can support community groups across the city to set up infant feeding, breastfeeding support groups. And I believe we have funded about, I think we've got 3 so far, and we've got another couple being set up. And these are real grassroots community support groups for parents who are not comfortable or choose not to attend more of the mainstream groups. So this will be a lot more localised and accessible for those people. So I've highlighted what the evidence says we need to do, and I've highlighted some of what other areas are doing, and I've shared what we're in the process of doing. So I'm going to have a quick look at the chat to see if there's any questions. Lottie, is there anything for us in there?
There isn't anything in the chat at the moment, apart from Chris has just mentioned that there might have been a peer support programme in Birmingham about 15 years ago, and some work on the first stages of the BFI accreditation.
Great, yeah, absolutely. And I think I don't think that was maintained as well as it could have been. So hence the reason why we've had to reestablish. So we've reviewed what we've had and then looked at how we can improve that. So hence is setting up that new peer support programme at the moment. So hopefully this time we'll be able to maintain the funding and the delivery of that going forward. Thanks, Chris. So if we want to make Birmingham a breastfeeding friendly city, we need to start with ourselves here at Birmingham City Council. So looking at what we do, is it good enough? And if not, how could it be better? And I suppose if you work for a different organisation, then asking yourselves those questions too would be useful. So what does the Birmingham City breastfeeding policy and experience look like? So we're going to do a quick Menti quiz to see if you know what some of the entitlements are. Lewis, can you add the Menti link and code into the chat again for me?
I've just added it.
Thank you, Lewis. And I'll give everyone a minute to get into that, if that's okay. And then I'll ask you a few quick questions. Thanks, Lottie. Okay, great. I can see there's a few of you on there. So if you, for whatever reason, can't get access to Menti, then please just put your comments in the chat. That would be absolutely acceptable. Thank you very much. Okay, so first question then, Lewis, please. So are you aware of if you're working for Birmingham City Council, are you aware of the Birmingham City Council breastfeeding policy? And I'm going to widen that out a little bit, because if you're not working at BCC, so are you aware of your own organisation's breastfeeding policy? So mostly no. So yeah, I think that's quite interesting. there will definitely be one. So I find that something perhaps isn't promoted as well as it could be, and maybe only to specific people. So yeah, that's quite telling. Thank you. Thanks very much for that. Next one, please, Lewis. So you need to let your employer know in writing that you'll still be breastfeeding when you return to work. True or false? Yeah, that's about right. Okay, so actually, it is true, and it might flex a little bit depending on your organisation. But it's to, and that might be conversations that you have on your return to work interviews as you're coming back from maternity leave. But essentially, it's true because they legally need to provide somewhere for you to breastfeed or to express. That might be a room, and ensure that there's a fridge to store milk. They also need to do a risk assessment, and they need to be able to offer you flexible hours as well in case you need to want to breastfeed elsewhere, and manage your breastfeeding differently. So yeah, so that's a true on that one. But like I said, it might flex a little bit depending on your return to work after maternity leaving the organisation that you work with. Okay, next one, Lewis, please. So yeah, your employer is required to pay for additional break time if required. Yeah, so it's a bit of a trick one here. So there's no law to it, but it is generally thought it's a reasonable to provide. So yeah, yeah, it's kind of a true, but there's no law around it. But yeah, reasonable to expect that, I think. And then final one, an employee can refuse to accommodate a request to breastfeed at work. Yeah, I think most of you are right with that one. Yeah, that's a false. So they can't refuse that. That would be a case of unlawful sex discrimination. So there's definitely a legal case against that. Okay, that's great. Thanks everybody for doing that. So to follow on from that, Beth Passy from our People Services here at Birmingham City Council is going to share with us what we should expect from the BCC policy. Over to you, Beth.
Thank you. So I'll just introduce myself to start with. So yeah, I'm Beth Passy. I'm one of the HR people partners here at BCC. So my role essentially is to support leadership teams with kind of all aspects of people management. If we just move on to the next slide, please. So I'm going to just cover off kind of very briefly guidance for employers kind of as a whole, and then I'll touch specifically on Birmingham City Council. So obviously, Joanne's covered some of this already, but obviously, the NHS is recommending that mothers continue to breastfeed for around the first 6 months. And obviously after that, many mums continue to choose to do that alongside introducing solid foods. And so, it's important that employers, as Joanne said, it is a requirement to have a policy around this, but it is important that, we continue to make sure that people are aware of it so that they can consider their options. So the Health and Safety Executive recommends that it's good practice for employers to provide private health and safety environment to breastfeeding mothers and for them to express and store milk. It requires suitable facilities where mothers can also rest. So I guess back to the point around kind of additional break times, it is important that those rest facilities are provided as well. And the risk assessment piece as well. So obviously any risk assessment should be carried out where an individual is returning to work and continuing to breastfeed after their return. Next slide, please. So with regards to kind of being an employee of Birmingham City Council and wishing to return to work and continue to breastfeed, there is information on this on the intranet if anybody wants to go and have a look. So we do require individuals to let us know. Obviously, the flexibility that can be afforded to individuals depends very specifically on the roles that people are in. So obviously, if somebody is home-based, it's far easier to provide that flexibility for individuals to continue to breastfeed. If somebody works a role that is kind of 100% on-site somewhere, it's a little bit more difficult. So the kind of terms and scenarios to accommodate that flexibility will be really different depending on roles. But wherever possible, every individual should be supported to work flexibly and provided with regular breaks and somewhere that they can either express or breastfeed. Back to, I guess, to the point about informing line managers, obviously that this should be a discussion with a line manager upon your plan to return to work. Obviously people services, HR can support those conversations if they're required, but we would hope that between line manager and individual, arrangements can be made for flexibility to provide the individual with the kind of the arrangements that they need to support their breastfeeding and their return to work. So as I say, each case is different. It's important to take each case by case. A guidance around it, I've put the link in there around the flex scheme. So there are other options around flexible working, flex scheme, obviously internally, that can be provided to support individuals with that. I think what I would say also on this is that it's not something that I believe is kind of overly utilised as one of the policies that we have at Birmingham City Council. It's not something that certainly leaders come and talk to me about. It isn't something that, you know, staff come and seek advice from me about. But I think the more conversations we have about this, the more people will become aware of actually what is available to them or to colleagues, you know, upon their return to work. So a welcome conversation, I think. So that's it from me. Thank you, Lewis.
Thanks, Beth. That's really helpful, and I think it's, you know, you're absolutely right, a conversation to be had, and to ensure that we're talking a lot more about this, because I don't think if it's something we're not talking about at Birmingham City Council, I imagine it's something that it's not too different across other organisations as well, and perhaps more so within the private sector than the public sector. So really important that we kind of pick this up and have any discussions on it. Thank you. So we've got some more mentee questions to get you to start helping us to understand what we need to do more of in a positive way. So we'd like to capture your thoughts and suggestions for businesses, including Birmingham City Council, to help improve the breastfeeding experience across the city. So again, whole group activity using Menti, same link and code as previous. And see, the first question we're asking you is, if we want to make Birmingham a breastfeeding friendly city to live and work, what are the key messages we need to share with businesses where parents work? Especially thinking about Birmingham City Council, what do they need to hear? So what are the key messages about supporting breastfeeding parents that we need to share with Birmingham City Council and other businesses where parents are employed? So you might want to think about your own, your partners, other family members and your friends' experience around this. What do you need to know, or what do they need to know from employers to make the breastfeeding experience a more positive one when you come back to work off maternity leave and through your parent journey as well? So make as many constructive suggestions as you can think of for this one, please. So we've got let employers know what the policy is. Yeah, you'd hope they did, because they're employers, but definitely both employers and employees being made aware of the policy and understanding how it impacts on them. Absolutely removing the stigma attached to breastfeeding, ensuring that there's a safe place to breastfeed, absolutely. Ensuring there is a safe space to talk and feel comfortable. For example, ensuring breastfeeding spaces are more welcoming for them and their children. Agreed. Promoting to businesses the benefits. Yeah, absolutely. We need to ensure that they understand what the good points are of their employees breastfeeding are. It is hard work, it can be uncomfortable, and you need a safe and private space, absolutely. Making sure that they know they aren't alone and limit the feeling of isolation. Very good, yeah, absolutely. And making sure that they know how to connect with those groups or community groups where they can get that support is absolutely key as well. Informing employees that they have a duty under the Equality Act, yeah. Images that represent the community, absolutely. So we're making sure that we're seeing people like us breastfeeding. And breastfeeding welcome here. Incentives such as Waterstones give a hot drink. Absolutely, we know that parents need to be refreshed and fully refreshed and watered to ensure that they're getting the appropriate nutrients and to breastfeed their babies. Expressing breaks and safe storage of breast milk, absolutely key. Tell employees where they can ask for advice and support. That's an excellent suggestion, actually. I'll certainly be sharing that on. And private spaces in public domain and separate from nappy changing areas. Yeah, absolutely. And is there a breastfeeding peer support group at BCC? You know what? We don't think that there is. And the reason we don't think there is because when we wanted to promote this, we couldn't find anything like that amongst the staff groups. So again, maybe something that could be set up to provide that again, that peer support and taking support services to the people. Absolutely. So these are some excellent suggestions here. So thank you very much. Okay, we'll move on to the next question. Which is in relation to businesses that parents use. So thinking about your experience out there as a punter. So what are the key messages about supporting breastfeeding parents we need to share with Birmingham City Council and other businesses where parents are customers? So that might be coffee shops, art galleries, supermarkets, libraries, community venues. Again, think about your own, your partners, your other family members and your friends' experience of breastfeeding when you're out and about as a customer in Birmingham. And think about, what do businesses need to think about? What do they need to know? What do they need to do to make the breastfeeding customer experience a positive one? Again, as many suggestions as you can think of, that would be great. Yep, so messages around how breastfeeding is normal, that kind of welcome breastfeeding scheme again. So you're welcome to breastfeed here, advertise feeding support groups in the settings, remove the taboo, social media needs to normalise breastfeeding, signs to advertise breastfeeding friendly businesses, again signage, big one, absolutely. Ensuring breastfeeding spaces aren't locked. Wow, yep, that's I would imagine that's a key one as well. Offering a space to do that, places to sit down, creating a dedicated welcome space. There's a lot here about feeling comfortable and confident to breastfeed in a space, and knowing that it's okay to do that and you're welcome to do that. And I think that's the key thing, isn't it? It's feeling welcome to be able to do that. Education for employers, absolutely clear, signposting, breastfeeding friendly, absolutely. That seems to be the key message to take away with this one for us. Visual aids in different, is that care, the different care areas, breastfeeding the babies? That's a good one actually, yeah. That's looking at that professional element. I like that actually. Yeah, you'll know what I'm going to do with all of these suggestions as we come towards the end. But yeah, that's a great suggestion. Yeah, and making sure there's a secure way of asking a member of staff in shops where the breastfeeding rooms are. And if we're doing that, it's making sure that all of the staff within shops or wherever it is that you are asking know. So, you know, it's not a big deal. It's actually information that they already know and can absolutely point you in the direction of, and they don't have to go off and ask somebody else. It's just information that they're clear on. So that's right. Information on how partners can support their partner when breastfeeding. That's a good point as well. Great, that's excellent suggestions there, thank you. And then a final question from us today, and it's a kind of blue sky thinking, so looking for lots of positive suggestions here if at all possible. So what does a breastfeeding friendly city to live and work look like? So if you went there to this place, what would people be doing? What would they be saying? What do we see when we go there? How do people feel? So thinking about some of your suggestions that you've made previously, if all of those positive things were instigated and were happening, what would that place look like? So what would people be doing? What are they saying? What do we see? How do people feel in a place where all of those things are taking place? Feeling welcome, supportive, normalised, encouraged and supported, knowing that it's easy access, it's clear, yeah, it's the norm, not the exception, open and honest place, it's safe, people feel safe to breastfeed without any judgment. You've got honest and open conversations between mothers about some of the challenges with breastfeeding, absolutely, because it's not always rosy for everybody. Lots of signage around, praise breastfeeding, some parents and infants out and about places, feeling younger and vibrant, because if you're not in your house or in a clinical space and you feel comfortable to breastfeed, then places would be much busier. Seeing breast milk as a medicine, inclusivity, accessibility. So absolutely, this sounds like a great place to be. People understand the benefits and I suppose welcome them as well. And lots of signage, absolutely. Yeah, you don't have to hide away in a toilet, not the most hygienic place to be breastfeeding baby, but this is what people are kind of expected to do. So some evidence around breast milk shared, less isolation, absolutely celebrating it. Yeah, finding the time and the opportunity to be able to celebrate this place that we live that accepts us breastfeeding and removing bottles from all nursery settings. I suppose that will come down to looking at that baby friendly initiative as well and understanding the guidance around that and maybe working to that. So within those community venues, so we can certainly look at that's something that we can do. I imagine quite difficult for nursery settings as well, especially where parents are bottle feeding their children, but certainly some work that could be done around that. There we go, bringing BFI into nursery and preschool venues and being allowed the time to do so. Yeah, I think, it's not a rush job, is it? As I'm sure those of you who've breastfed would be able to say, it's not something that if you're feeling stressed and rushed, then this isn't a pleasant experience for you or baby. So yeah, absolutely. Some, again, excellent suggestions and a great place that would make me want to visit for sure. So that's pretty much it for today. I've kind of brought you here to rinse you of all of your suggestions, to take the time to utilise those, and I'll explain what we're going to do with those. So again, thank you for giving your time up to come along today. All of the suggestions you've made were going to be shared with our BCC colleagues, so Beth will take those back and they'll help improve our own standing as a breastfeeding friendly organisation. So thinking about what we do as an organisation, how we set our standards, how we should be role models within the city. It'll also play into our breastfeeding friendly city work. So it will be shared with the social marketing agency, who will be creating the messages and resources that can be used to promote breastfeeding and help improve the rates in Birmingham. And they'll be doing most of that work early in the new year. So we have a survey coming out next week around understanding people's attitudes towards breastfeeding. And if you'd like to take part in that, if you can pop your email address into the chat and we'll send a link out to you so you can take part in that. But otherwise, that's pretty much it for today. Really appreciate your time and thank you so much for coming. If there's any questions or anything before we go, then please put your hand up. Nothing too difficult. That'd be great. Fabulous. Okay then, everyone. Thanks very much. Enjoy the rest of your day. Thank you.